It was a little over a year ago. I had a biopsy done by a local urologist, and when I went to see him, he told me that I had a low-grade prostate cancer cells that were developing, and his advice was that I should have the prostate removed within a period of a year or so. I was quite surprised. I'd had a biopsy done 3 years prior to that, and it came out clean. So 3 years prior to that, I was clean, and I was quite surprised when I walked into the urologist's office a second time to be told that I had prostate cancer and that his recommendation was that it should be removed. I really never paid too much attention to it. It wasn't something that ran in our family. I was aware of friends who'd contracted it, but other than that, I didn't make it my business to spend a lot of time trying to get more information about what it was. After the diagnosis, I sure spent an awful lot of time on the internet just trying to get a better understanding of how it would progress. I did get a second opinion based on the biopsy results that I had received from a urologist in Winnipeg who, because of the grade, suggested that I could wait for another 10 years and it wouldn't get serious, but by that time it would probably start developing into something that I should take a look at. So essentially I was left with the decision as to whether or not I should wait for a bit or have it taken out. It was like a bit like a fish smacking you up the side of the head. I mean, it suddenly makes you realize that A, you're old and aging sucks, and B, you're mortal, and that all illusions otherwise dissipate pretty quickly. My initial reaction to it was not necessarily to think the worst, but to start making all kinds of preparations in case something would go wrong and that I wouldn't survive this. And my second reaction was, how and when do I tell my family, and what do I tell them? So those two emotional hits, being something that was totally unexpected to begin with, were the two most difficult parts of the initial stages in this. I didn't find the decision making to be as difficult afterwards as those first two emotional impacts. I finally came to the point where I said it is what it is, and you have to make decisions about how you want to proceed, and I do that pretty methodically anyway. But the emotional impact of it, I think, was really the most challenging part of it. Well, I did talk to friends. My first inclination was to find out about the progress of the cancer as much as I could and more fully understand the medical part of it before I told my wife. And I was advised by friends that I shouldn't delay doing that, and I think I did longer than perhaps was necessarily advisable to do. But I really wanted to make sure that I knew what I was talking about before I told my wife, simply because I knew she was going to be both upset by it and worried by it.
So were you trying to protect her?
I think that was...
What is the sense that you were trying to do?
Well, I rode in on my white horse and said, I have to protect my family.
My first reaction is I didn't want her to worry unduly. She was going to be worried anyway, and although she's not the worrying kind, I just wanted to make sure that I was in a position to be as honest as I could about what I had, what the prognosis was for surviving this, and getting on with things. And I think that was the primary reason for the delay, in addition to wanting to find the right emotional timbre and time to tell her.
And it worked out?
It did, more surprisingly than I thought it would, in a sense that she took it. Usually when men, I think, worry about how their partners are going to take things, they tend to exaggerate the emotional impact of it. I'm not saying she just brushed it off and said, okay, well, let me know how it goes. She was very, very supportive, and I think her initial reaction to me perhaps belied a concern that she had underneath that was a bit more graver than she put on. I'm not saying she put on a brave face, but I probably had wished that I had told her a bit sooner. There wasn't an enormous delay. It was about a period of a month afterwards, and then after that I told my daughter and my son, feeling much more confident that this was something that was going to be overcome quite easily, relatively speaking. I think what aided and abetted my delay and the confidence in telling her what I did and how I did it was getting the second opinion, that it was a very low-grade, slow-progressing cancer, and that I did have the option of waiting. The very first option given to me was radiation, and I decided after looking into that and hearing some professional opinions about it that it was not a good option for me because of the possibility that if it didn't work, removing the prostate afterwards would be much more complicated because of scar tissue, etc. The second option was a radical prostatectomy. The third and fourth were laparoscopic and robotic laparoscopic respectively, and I didn't think the latter of those two had progressed far enough for me to have a comfort level with it. I spoke to a friend who indicated that he had had a laparoscopic prostatectomy done at St. Joseph's in Hamilton by a well-known doctor who had excelled in that procedure. He was very, very pleased with the results of it. And the more I looked into it, the more I realized that that would be a benefit to me. There's a much faster recovery time. There's not as serious an issue with pain, and having testicles and being a man, like all others, I have an aversion to it. So I didn't want to go through that procedure having had a major operation before. So the choice actually was relatively easy. I went to see him 2 or 3 times, and every time I did, that comfort level went up. My PSA wasn't, scaling up quickly. So between the time I had the first diagnosis of the biopsy and the time that I had the laparoscopic procedure, 1 year had already passed. I was quite pleased with it. Certainly the quality and professionalism of the doctoring staff was excellent. I had a friend of mine that came into the hospital who just returned from the Caribbean, and he came to visit me while I was there, and he brought me a nutmeg. I don't know if I told you this story, and a little shot of white rum, which the nurses didn't know about. So the white rum was very quickly dispatched, which helped with the anti-inflammatory and the pain because it was only my 3rd day. But the nutmeg, if you've ever seen a real one, is about the size of a prostate, and it looks like a prostate. So I told Carl, my friend, that I was actually going to take this home and bronze it. So I have it in a little sort of white see-through bag that I've got there that I fully intend that I'm going to bronze when I have the time to do it, because it'll remind me of having had my prostate out. And I'll be able to tell people, this is it. They gave it back to me. It's bronzed. The most difficult thing was getting up and walking 3 or 4 times a day, dragging my pole around with me, trying to look somewhat respectable with my ass flying in the wind, and walking the corridors back and forth. That was, just on anti-inflammatories, was a bit painful, but good for the character. But the catheter, it wasn't as bad the first time as it was the second. What was worse about it was walking around with it for the 2-week period after I was let go from the hospital. And you almost felt that you were taking your penis for a walk. It felt like a leash almost all of the time, and it made it difficult to sleep. A lot of this stuff will be cut out, right, guys? And it made it difficult.
That part
It made it difficult to sleep. You really had to adjust to having a catheter in there. And 2 weeks afterwards, when it came out, it was great. I was going to take it out myself. I'd taken my stitches out myself because he said go ahead and do it as long as you use this procedure and this little clamp stuff, and that seemed to go well. But the more I thought about it, the more I thought, no, professional assistance might be necessary, especially if the balloon doesn't deflate. That would have been an interesting experience. I had some post-op complications that were generally connected to the leash, or the catheter, I should say, in that the urethra didn't properly heal to the lower part of the bladder, and that caused bleeding in the urine and sometimes obstruction. And because of the traveling I do with my work, that became quite worrisome. I would often be in places where there was no medical help, and it would be at least 6 to 10 hours away. And if I couldn't urinate or pass water or whatever, then that would become a serious problem. I did have a cystoscopy done within about the first 4 months of the operation, and he had basically confirmed that that's what had happened. Recommended that I have the catheter reinstalled, so I had the leash in there for another 2 weeks. Put me on antibiotics, and that seemed to clear it up pretty quickly. Erectile function and nerve-sparing procedures were put in place, and how can I put it discreetly? I'm kind of looking forward to the day when I prove him to be right, and that's You know, when you get to be 62 or 63, the libido is not as actively engaged. Your hormonal levels aren't as pronounced as they were 20 or 30 years ago. So I think that really becomes an advantage when you're talking about your sexual relationship with your partner. And you know, she's been enormously patient and understanding with all of that. She obviously knows what it's all about. I tend to be less serious about it than one or two other people I know whose identity is so closely attached to their sexuality, to their ability to have an erection, to be blunt. And yet their partners are just totally the opposite of that. Like it's not that there's a miscommunication, it's just that they're not reading their female partner's level of anxiety about that, and they tend to be overstating what it likely is, which says more about them than it does about, you know, their partner. But I mean, who knows? Everybody's level of sexual functioning is different. Their level of interest in sex is different. You know, their hormonal charges are different. Goodness, if something like this happened to me 40 years ago, I think I would be a hell of a lot more identifying with, you know, sexual dysfunction than I would be now. Within 8 months to a year, you're supposed to have some degree of erectile function return to you. And I'm just on the cusp of that, so I'm looking forward to these dates. I have dates that I'm looking forward to now that I never thought I'd be looking forward to, and those are some of them. With my son Jesse, you know, until he turns 25, whatever advice you provide is advice. And it's duly notched on the pistol of his belt as advice. And at some point in time, when he discovers that he's not immortal, he'll probably start taking that seriously. I've advised when he gets a checkup, whenever that is, that, you know, he obviously has a prostate examination, a rectal prostate examination, and I think that will probably just, you know, be due course for him. I found that his emotional support for me was just really tremendous. I could tell he was worried, and I would do what I could to assuage his concerns and his feelings legitimately. I didn't underreact or overreact, and I just found that discussing it with him probably made him more aware of it. But whether or not he would be convinced to have regular prostate exams because of my experience at 62 when he's only 23, you know, I'd like to think that I have an impact on him, but I don't think it's quite that pronounced.
If I was just newly diagnosed with prostate cancer, what kind of advice would you be giving me?
Well, based on my own experience, I think the first thing I would suggest would be to ask how well equipped emotionally he was to deal with the news and how he planned to deal with it with respect to his family. In a secondary field, I would certainly suggest that he get a second opinion, both of the biopsy results and of the prescription provided by the doctor, because there are varying degrees of what you can do with it, and to fully research the options from radioactivity to radiation treatment right through to a radical prostatectomy and the other procedures that would remove a prostate. So I think in that order of importance is how I would convey that information to someone that I knew that had it. I don't regret having done it. There's a part of me that says maybe, you know, for all the trouble and the discomfort and stuff that I went through and the dislodging from my regular routine of life, that I could have waited. But I think all in all, in retrospect, I'm relatively pleased that I did have it out when I did. I sort of looked upon this experience as a hiccup. I generally tend to be an impatient person to begin with, and I actually surprised myself to the extent where I very quickly came to grips with the fact that it is what it is. I wanted to get through it, I wanted to get over it, and I wanted to get on with my life. I'm not saying it was an annoyance, but it was a bridge over troubled waters that I wasn't planning to cross at that particular time in my life. And, you know, touch wood, I'm glad that it's over with. So far, the PSA results that have come back from the 3 tests that I've done are all 0, and that's good. And I'm not saying that I'm cured, but I don't like using the language of being a cancer survivor. I mean, to me, it was cancerous, it's out of there, it didn't go beyond the extremities of the perimeter or the margins, and so I don't have cancer. I'm not saying I'm cancer-free. That might be popping up in a different part of my body as we speak, and I don't know it, but I don't have the disease anymore.